In this video, we're going to go over getting a hemoglobin sample. So ultimately what we're doing is we're trying to see just a quick overall view of our blood health, for lack of a better word, to see, as a first step, to see if whether or not we can be a donor for Jorge. So what we're going to do is we're going to take a sample to get our hemoglobin level. Now remember, hemoglobin basically refers to the oxygen carrying capacity of our red blood cells. So we want to make sure that we have the right amount of hemoglobin that indicates that we're getting the right amount of oxygen delivered. If our hemoglobin is too low, that indicates a possible anemic situation where our blood is not delivering the oxygen that's needed. Or we could have too high of a hemoglobin, which means that we're producing too many red blood cells, and that can also affect the viscosity of our blood and can lead to other issues. So this is just a way to get a general idea of the oxygen carrying capacity or the overall health of our blood. So we're going to take a blood sample. So we would take this, we would use our lancet here, put it up against our finger, get the blood. We kind of want to squeeze that out as much as we possibly can. And then we're going to collect this sample of blood in this container here. See how it kind of sucks it all up. And then we're going to put this container or this little thing into what's called a hemocube, which will read our blood hemoglobin levels. So we're going to put our blood collection into the hemocube unit. We're going to shut it, and it's going to give us a reading. And once you get the reading, you're then going to compare it to the chart to see whether or not we are in the normal range for hemoglobin levels. So the hemoglobin level is 13.9 grams per deciliter. So you can look at the chart and you can determine whether or not that hemoglobin reading is normal based on your gender and based on your age. Now you can continue on with part 2 of the experiment, looking at blood type.